Now, this is the 50 years male patient, history of blunt trauma on the epigastric region. 4 days before, सीधा थी जो 4 days before blunt trauma at the epigastric region, and complaint of vomiting since 2-3 days, no fever, no diarrhea. It is a case of blunt pancreatic injury. Here, if we see this pancreas, it is little bit diffusely edematous and having a hyperechoic margin. Here the margin of the pancreas and the texture is little bit hyperechoic. Very minute observation if you observe it carefully here. Second thing, surrounding this pancreas there is a peripancreatic fluid collection, thick collection. This is due to the what we say, the pancreatic enzymes which is extravasated and showing the inflammatory changes in the peripancreatic space. Here, this is the peripancreatic space anterior to the pancreatic head, and there is soft tissue inflammation. Here, this is portal vein, and above the portal vein here, this area is showing hyperechoic texture. It is due to inflammatory changes of the soft tissue. Here we can see in this area this hyperechoic soft tissue. Here also, and this is the tubular structure, which is the inferior mesentric vein, which is draining the transverse colon and the descending colon. This vein is showing echogenic texture inside the lumen, and it is due to the thrombosis, roughly 11 to 12 centimeter in the length. This is dilated also. If you can see, this texture is very echogenic inside this segment. Normally, if we look at the vein, it is anechoic. And why this is inferior mesentric vein? There is a justification that here this descending colon has become thickened in its whole length, this descending colon, tracing from the left splenic flexure till the sigmoid colon. This descending colon is thickened. This is the colon, and the transverse colon is also thickened. Here, this is the transverse colon. This is the transverse colon. Here there is a little bit more thickening of the wall of the transverse colon. This transverse colon is from here to here. There is marked thickening in the transverse colon. This is the area of the blunt trauma. this one, transverse colon. Once again, looking at the descending colon, tracing from up splenic flexure to sigmoid colon. And there is echogenic fluid in the pelvis also here. This is due to the pancreatic injury, pancreatitis, fluid collection. This fluid is also echogenic due to elevated serum amylase and lipase, pancreatitis. And this inferior mesentric vein, it is located above the pancreatic head. This is the portal vein. This is the inferior mesentric vein. It is not showing color flow. No color flow due to thrombosis. And regarding this transverse colon, in linear probe it was not properly appreciated, but here in the by convex probe I will show you. This is the transverse colon, this thickened segment. Here we can see it very clearly. This is the transverse colon. And beneath this transverse colon there is fluid collection here. This is the descending colon over here, this area. If we take the longitudinal section, in longitudinal section it is not clearly appreciated. Peripancreatic collection. And this pancreas diffusely edematous and shows heterogeneous texture, hyperechoic and little bit hypoechoic. Hyperechoic texture is more in the parenchyma. This is the common bile duct. This is the portal vein. Spleen is marginally enlarged. Very early changes of splenomegaly. In long axis around 13 centimeter. This splenic vein is patent. It is showing color flow. Sida. This portal vein is also patent. It is showing color flow. This is the portal vein. This is the portal vein. peripancreatic, this soft tissue inflammation, hyperechoic texture, this area. This is aorta. This is mesentric, inferior mesentric vein. This is aorta. That is not our concern regarding the aorta. It is retroperitoneal, behind the pancreas. This is aorta. And one more thing, yes, this is IVC over here. And this is inferior mesentric vein. Here in this photo, descending colon. This was by mistake portal vein. This is the inferior mesentric vein. It was measuring 17 mm diameter. This is pancreas, pancreatic fluid, peripancreatic. Good case.